Next on the agenda, item number 7, file number 17129, complaint filed by Patrick Roddie against the Department of Public Health for allegedly violating Administrative Code Section 67.21 by failing to respond to a public records request in a timely and/or complete manner. This matter was heard by the Complaint Committee on January 23rd, 2018.
And thank you for getting that in so quickly. That was just 2 weeks ago.
Okay.
Yes.
Great.
Would you like me, I believe that Member Fisher and Member Hinsey were present.
Right.
Yeah. Would you like me to provide a summary, or would you like to do
I would like that. That's up to you, Member Hinsey.
Yeah, if I remember anything. If I remember anything supplemental to your summary,
Through the chair, you know we will add to it when you're done, so go.
Yes. At the meeting, Mr. Roddie summarized that the reason for his records request and stated that if the department has access to public records held by other organizations, they must retrieve and provide them. At that meeting, the Department of Public Health stated that the department is unable to and are not required to create records or reports, The Department of Public Health did contact the State Department of Public Health, and they were informed that requests for the type of information should be submitted directly to the California Department of Public Health, and that the city's Department of Public Health is not in possession of the records, and it's in the possession of the state.
Through the chair, can I add
Yeah.
a sentence or two?
Go ahead.
So this was very interesting, notwithstanding the fact that what Dr. Roddie is doing is actually really, really interesting, but that's...
Mr.
Sorry. Mr. Roddie is doing is very interesting, but that's not relevant. What's relevant is the nuance of this, and we wanted to have DCA Cola here to comment on this, is two things were going on. One, there was, the first thing that popped up in my head was, well, that record doesn't exist, we have to create a report, and that's not part of the Sunshine Ordinance. So there is no creating of a report. So we were kind of like, what does that mean? The other side to this is we were told by the city, we're not allowed to give you that information, but the state is. So that's all I have to say.
and I think we recommended no violation.
Yes, the recommendation was to find no violation.
Yes.
I think we came to that conclusion because we thought that these were state records, and that, although not to say that Mr. Roddie didn't do the right thing by following his local process, but we determined that it was state record.
And we sort of, I'm sorry, you done, Member Hinsey?
Yeah.
We wanted him to have his, quote, day in court here because while Member Hinsey and I were unpacking it, we weren't 100% sure, and we wanted, again, Mr. Roddie to come up here and state his case with DCA Cola here and the rest of the team here that might have a little more input.
Yeah.
I am really done.
Yeah.
Okay, great. Then let's have the complainant petitioner come forward. You have 5 minutes, sir.
Thank you, and thanks for letting me do all the camera stuff here as well. Like I said, my name is Patrick Roddie. I am a geoengineering researcher and activist, and I am trying to find out how many San Franciscans have been killed by the spraying in the skies. Alzheimer's has risen 135-fold since this started, so I just wanted to drill down and find out, are there increases on heavy spray days? So, expecting some pushback, I, on August 22nd, asked them for the existence of records. How many records are there for each of these days? That does not violate HIPAA. I'm not asking for names, I'm not asking for nothing, I'm just asking, did someone die? And I am told by the custodian of record of the Department of Public Health, which houses the Vital Statistics Department, that no, we can't tell you if anybody died. when there is foul play, you must be able to access death records. If there was an Ebola outbreak, you'd need to know. We have the CDC who wait 23 months to report any deaths. I think we should have access to deaths. I mean, I was a newspaper reporter, you know, and you'd call up the cops and say, oh yeah, what happened? And they say, oh, so-and-so died, there was a car wreck. You know, deaths are not state secrets. They must not be. And I find it really quite disgusting, frankly, that the Department of Public Health, which used to house and store death records, is hiding behind this subsection, you know, 102330 section 2, which says comprehensive records are confidential. I'm not asking for comprehensive records in either of these things. First, I asked for how many there are, and then I asked for a subsection. And in the second one, I asked for 8 fields, and on a California death certificate, there's 40 fields. It is not comprehensive. I looked up comprehensive in Black's Law. It's not there. So Merriam-Webster, comprehensive says, covering completely or broadly. The first one is not at all, frankly. I'm just asking them how many records are there. And they'll say, oh, but that's owned by the state. Well, we employ the Department of Public Health to transmit data on city property to the state. And that's secret? I'm baffled. I'm doing this for the health of everyone in San Francisco, and by extent the world. We're under assault, and the fact that they will not even admit if anybody died. Why do we have a public health department? What's the Department of Vital Statistics, or the Division of Vital Statistics even doing there? And what is the custodian of public record doing? Apart from stonewalling and blocking every move. Why is this such a secret? If there is an epidemic, that's in the public interest. Also, in reading I haven't even been told if any of these records are exempt from disclosure, any part of them. The existence of the record is that confidential? I have one of my favorite parts of the Sunshine Ordinance is section 67.36. The provisions of this Sunshine Ordinance supersede other local laws. Whenever a conflict in local law is identified, the requirement which would result in greater or more expedited public access to public information shall apply. And the state law is ambiguously written. It does not specify what comprehensive is. It says the indices. The indices cover every county in the state. Riverside, LA, Shasta. I'm not asking for that. I'm just looking for stuff in San Francisco. So it's, clearly we should be told if anybody died. So that's the least I would ask. So, thank you.
Are there any persons or witnesses providing any facts or evidence on behalf of the complainant petitioner? Seeing none, respondent. Is respondent present?
No.
Thank you.
Good evening, members of the Sunshine Ordinance Task Force. My name is Linda Acosta. I work for the Public Health Department. And I have been told by the California Department of Public Health that I'm not allowed to give these records out. And I can read you what they wrote to me. According to Health and Safety Code 102230, Section 2, the birth, death, and marriage record indices prepared pursuant to paragraph 1 and all comprehensive birth, death, and marriage record indices prepared or maintained by local registrars and county recorders shall be kept confidential and shall be exempt from disclosure under the California Public Records Act. Please defer to your legal counsel regarding your response. Here's a link to our applications below. So then we have a link where people can get this information. So that's typically where researchers go to get this data. So yes, it's available, but I, as San Francisco, am not allowed to give it out. I have a graphic. I'm not sure how this will work.
Is it in our, was it submitted for the record?
No. Okay. Basically, it shows that it's not our database and that only the California Department of Public Health is able to get data out.
Question? In the 6 years I've been here, people have shown graphics. Mr. Hartz would come up and show these funny cartoons and stuff. When did this rule change that we can't put things up?
If it's pertinent to the evidence of the case, what Mr. Hartz does is just list the number of cases that he's brought before us. It's not necessarily.
Well, it's also shown us graphics of things that happen.
It usually isn't contained in the record. It's in our packet. So he's just highlighting what's already in the packet. So because there may be 100 pages or so. If you want to be able to enter it in, the purpose is if it's a piece of information that could change the course of the case.
I don't think it is.
But you don't know that. We haven't seen it yet. We don't know what it is. But if the petitioner, if the complainant hasn't had an opportunity to see it, and it might change the whole course of the case, then that's not fair to the petitioner or any other party, even if the petitioner brought something forward. Everybody has a right to be able to discovery and to have some time to prepare. So if this, for some reason, that happens, what we could do is we can have Ms. Costa show.
Yeah, I think you're going down a whole other path. I think Mr. Roddie has already seen this. We're the only ones who haven't seen it.
He's shaking his head no. So I don't want to assume anything.
No.
If you want to see this document, the best way to deal with it, and this is the way the task force has done it before, is to have whichever party wants to present the document to the other party. If the other party says this is innocuous, doesn't change my case at all, fine. If it does, then we cannot accept it as part of it.
Cheryl, again, I think you're going down a whole different path than I'm going. So what I'm getting at here is, I believe I totally forgot your name. Costa said, blah, 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 we refer people, and there's a link. Now I'm hearing that Mr. Roddie does not have that information. And this reminds me of the case with the coroner, where the coroner said, we have this information, and the complainant said, I don't have it, and the two of them went in the back room and they gave it to each other, and they were done. So it sounds like you're saying there's something available when you don't have it.
No, she wants to put something on the overhead.
That is going to give Mr. Roddie information. No.
There's actually a different graphic that shows that the California Department of Public Health owns that database. That's all it is.
And doesn't it also say, for further information, contact blah, blah, blah?
Yeah, but that's one piece of what's on that paper or that document. What about all the rest of the content on that document?
I'm just trying to get him.
So I've met.
Why we're all here.
Can I say something? I've met with Mr. Roddie, and he has the link. We sat down, and I gave him the application. I printed it out for him. I said it is available, but this is the process.
It's not our practice to introduce new information that's not in our packet that might have an effect on one of the other parties.
It's not a great graphic.
Okay, and the question, it's just because none of us know besides the folks that were at the committee, none of us had seen this. So we want to protect everybody and make sure that everybody has a fair chance. That's all. Okay.
Throwing out the baby with the bathwater.
Continue. Is there anything else you?
Yeah, I just, I can't give that information out. This is, I think, our 4th time here for this, so really I wish I could give it out, but I can't.
Okay.
Thank you.
Very good, thank you. Are there any persons or witnesses providing facts or evidence on behalf of the respondent? Seeing the members.
Yeah, I have a quick question for the chair. How was this 4th time? I thought this was only the 2nd time we've heard
I
this.
believe it was heard. It was There was an appearance of an agreement between the parties, and the matter was withdrawn. And after that fact, the complaint was refiled.
Okay, but this is only the first time for most people, and only the second time for Member Hinsey and I hearing this. Is that correct?
It's gone before the complaint committee
Oh, it had.
3 times
Okay.
in different versions, different file numbers.
Okay. Thank you.
Member Wolf?
I have a question for the representative from the Department of Public Health.
Ms. Costa.
Ms. Costa? Ms. Acosta or? A Costa?
Yes, thank you.
So, my brain's having a hard time wrapping around this, so if we can just sort of walk through
Sure.
each of these piece by piece. So, earlier you said that the database of life and death records, or maybe just death records, is maintained, and I think you actually said owned by the state of California. Is that?
Owned, operated, controlled, all of the above.
However, the data that the city and county of San Francisco sends to the state of California to put in that database doesn't retroactively become the property of the state of California, does it?
We don't ever own that property, so what we do is we go in, this is, I don't use these records, this is me understanding the process. We go in and we check boxes to say, you know, the coroner's report is here, you know, the physician's report is here, and then it goes to the state.
Okay, but like if John Doe dies in San Francisco, let's say of totally natural causes so that we don't get the virtue of having like all the coroner reports. So they die age 150, whatever. Does the Department of Public Health make a record at any point that that person has died?
If a family member came in and requested a death record, a death certificate, or whoever is able to collect that, they would pay the fee and they would print out that death certificate.
Okay, but like if you call the funeral, like you have to, if someone dies, you can't just bury them in your backyard. So there's some sort of record, like does the funeral home, if someone dies, I call the funeral home is gonna have to tell you that someone died, right? Before they can.
They go
take care
into the
of it.
same database and do their portion, and then we go into the same database and check off that everything's been done.
So the funeral home is engaging with the state database.
Yes.
And they're going above the city government's infrastructures. It's never actually passing through San Francisco's possession, that data.
Exactly.
Okay. So, in essence, a lot of this data is never actually in your possession other than by accessing it through the state database, is what you're saying?
Yes.
Okay. So, what records, if any, related to deaths other than the state database is in possession of the Department of Public Health?
None.
None. Okay. So the only access point to any of the information that the complainant has requested is through a database owned, maintained, and controlled by the state of California.
Yes.
Great. That's super helpful. It seems like the coroner would have some record of some deaths. Did you suggest that the complainant reach out for whatever records the coroner might have?
From what I understand, the California Department of Public Health is the body that gives out information to researchers. So they are the ones that control data, and there's a process for it. It's very clear application for it. You say what you're researching, they send you the data. So I sent him there.
Okay, great. Thanks so much. If I could speak to the complainant for 1 second.
I'd like to make a comment before you ask or after.
Go ahead, but make it brief.
Okay, by the way, the note that came from the California Department of Public Health saying you can't have this information was referring to my second complaint, in which I asked for cause of death, underlying cause of death, age, gender, sex, and there were 8 fields. Records inside the data. Inside the records. My first request was for how many freaking records are there? I'm not even asking the contents of them, so it's not within the indices, so it's not covered by that section.
Okay.
They haven't answered that, but continue.
Sure.
Sorry.
Let's roll through these questions real fast. So it sounds to me like the records that you're requesting are only accessible through the San Francisco Department of Health by accessing a state database.
Yes and no. If you go across the street and request a death certificate, the Department of Public Health just pulls up the data from the electronic death record system and then just print it out. That is accessible to the Department of Public Health, and since they are the ones who certified it, they should have right to find out how many. There should be a log somewhere.
I understand the point you're making,
right.
But the previous testimony suggests that the tool that she uses to obtain that information is a database maintained by the state of California, and she's testifying that the state of California is telling her she can't give that information. But let me just walk through a couple of these pieces here, and then I'm sure someone else will have questions and you'll have a chance for a rebuttal at the end. Have you looked into what data you could potentially get from the county coroner's office?
I haven't gone. I got stonewalled by them, so I got sent around. First, I went to the coroner, and they said, "No, go to Department of Public Health." Department of Public Health sent me to the clerk's office, county clerk's office, and they store death records from 3 years and back. So actually, the first half of my data is sitting in the county clerk's office. They have it. But I wanted that complete period, so I went through the Department of Public Health.
Okay, well, I would encourage you to follow this sort of same process you've taken to the one agency to any other agencies that might have any or all of the data.
Police even, you know.
In the process, you may or may not get a complete record of data, but if you have enough incomplete records, you maybe can piece them together. Is there, so, from what I'm hearing, if I had to read everything just on a superficial basis, the Department of Public Health is saying they don't possess these records. They're owned by the state of California, and they have access to that database.
Have access to.
And the state of California is telling them, no, you can't give it to this gentleman. He needs to go through us. Do you doubt that testimony, or is there some other reason there should be a violation found for?
If you read the section of the public health, it talks about the indices, which are complete databases. Obviously, they're not going to give those out. And then they talk about comprehensive death records. I'm not asking, neither of these apply to my request. And in any case, that was referring to my more detailed request when I asked for 8 fields off the death certificate, and not for the existence of the records themselves. The California Department of Public Health have not answered that question, and Department of Public Health are quietly sort of forgetting that's even a thing. I'm still waiting. I've been waiting since August 22nd. I've been told why. These deaths are somehow a state secret. They should have a record of how many times they logged in, at least.
No, I fully understand.
And I've been totally stonewalled, sorry.
I'm just trying to sort of walk through what the potential legal violation was. So, like, you know, if you ask for my Hulu password and I call Hulu up and ask whether I can give my Hulu password to a random person, they say no, there's not much we can do about it. And it sounds like the state of California is tying our Department of Public Health's hands in providing you that information. Now, are you arguing that that's an unlawful tying of the hands by the state of California? I'm just trying to figure out what sort of path there is for potential violation.
First of all, I'd like to I at least want to know how many people died. That has not been addressed by the Department of Public Health in California. They haven't said, is the existence of a record exempt? They haven't answered that. I need to know that at least. And beyond that, what in this record is secret? Because, you know, for $22 I can go across the street and get a death certificate. You know, that's not secret. I mean, when I first tried doing this in May, I said, yeah, sure, you can do it. If you pay $22 for every single death record, yeah, you can have it. So it's not secret. They're hiding this stuff for some reason, and I think it's this. there seems to be an awful lot of pushback on something which is a very simple call. I mean, the first time I came and I was asking for, how many people died per day, I said, oh, we can't do that. It would be too hard. We'd have to run the report 800 times. Well,
I'm sorry, who said that to you, the state or the city?
no, Linda told me. She at the first committee meeting I was here. This is my fourth. There were 3 committee meetings I came to beforehand. When I requested this, she said, "Can't do it because it's too hard. It would take us too long to do. We'd have to run a report for each single day, and that would take so long. They could have sent a file clerk." If it was, through a Indiana Jones warehouse and gotten the same information. So that was the original argument, which was, sort of frowned upon by the committee members. This is, why can't I find out how many people died? And by the way, the reason I'm not pursuing the state aggressively is because the restrictions that they lay on this. For example, if I find that on heavy spray days there's an extra 40 people die of respiratory failure, that is data from the database, and at the end of my research I must destroy my data. And I have nothing to back it up unless someone else has to jump through every single hoop that I have. It is not, the restrictions on there, there's cost, and they are keeping this very, very, very tight, just like the CDC.
But the point is if there is existing law that allows that to happen, whether or not it's nefarious, but the law is the law, and that's what's going to be followed. So that would demand a change in the law for your needs to be met. Well,
the death record should be.
It should, or
it should, but the fact that the Sunshine Ordinance says anytime there's a conflict between local laws, we're in California. California is local,
But the point here is if the DPH is claiming and citing state law, and that this information is not public records owned or controlled by San Francisco, but by the state, specifically what you're asking for, then it's not a local law.
The Department of Public Health has access to this data, which came through here. They can say, yes, so-and-so died here. Because for example, if I took a picture of everybody here, Dave, Bruce, all that, and that photograph is copyrighted, it has your names on it, does that stop you being able to use your own name? No. Just because they have a proprietary product which includes these things and it doesn't make it theirs. And we can demand, since the city themselves logged in so many times, and we to even get the terminal logs, those things, nothing, completely shut down. I don't even know if anybody died. And we have, again, I'm going back to, Department of Public Health, what are they there for? But I'd like to go back. The law that was quoted referred to.
I want you to hold on.
Sorry.
Because I have somebody else
Sorry.
to ask a question.
Sorry, I would like to ask Liz Cosmos questions.
Yeah.
Okay, so
But-
hold on a second. Mr. Roddie, why don't you finish your thought?
Yeah.
And then we'll.
Again, the law quoted by not a lawyer from the California Department of Public Health referred to the second request where I was asking for contents of records. My first request was not for contents of records, it was just the existence of records. That's something quite different. I'm certainly not comprehensive.
Perfect, thank you.
Hi. So I have 3 questions. The first 2 are just related to definitions. I was wondering if you could just define what indices are in the context of the law you cited in this.
Is that something I'm required to do?
No, I just want to make sure I understand, because you're citing this thing about how I'm not releasing indices, and I just want to make sure I understand what an indices is. You don't have to, I guess it's not a legal requirement, but I can't, understand.
I assume it's records,
Okay, so,
but let me look back at the note. I would interpret that as records.
okay, so we're not sure at this point what indices is. I mean, it is a record, but record could be anything.
Collections of records.
Okay, and then what is a registrar in terms of what the Department of Public Health does?
So as a local registrar, again, we go into the California database and check a number of boxes saying that, everyone has done their part. So the coroner has submitted their report, the physician has signed off on it, the record is complete, and it goes to the state.
So as we were having the discussion, as I was going through the file here, I felt like I had this feeling that I'd seen some of this data that he was asking for already on the public health website. And so what I was looking at was the 2016 San Francisco Community Health Needs Assessment, which includes an entire section called Mortality in San Francisco. And the first sentence of that section is, there were 22,450 deaths in San Francisco between 2010 and 2013. And what I'm wondering, and I mean, it has it broken up by like race, it has it broken up by like what the disease was, it has all sorts of information and data here. And I'm wondering what the difference is between the data in this report and the data that the complainant was seeking.
You would have to ask the epidemiologists that prepared that report how they got their data. I'm not aware of how they would get that data. I don't work with them, so I don't know.
Okay, thank you. That's all.
But
I have a question. So the first request for the number of people who died by death, this information is on the state website?
I don't know what's in the state database. I don't think that there's a report by day of how many people die in the city. What there is a collection of death records.
Okay.
So-
And there's no digital tool, report writing tool that somebody can go? So is
So there
the,
may be, but it's the state that controls it.
so the city, San Francisco Department of Public Health can't even give Mr. Roddie a number?
Correct.
Even if it took you half an hour to produce it, the state doesn't allow you to
Correct.
disseminate? Okay.
don't forget, I have some questions. So under State Health Safety Code 102230A2, that's the one that you're referring to, it says the birth, death, and marriage record indices are prepared pursuant to paragraph 1, and all comprehensive birth, death, and marriage record indices prepared or maintained by local registrars and county recorders shall be kept confidential and shall be exempt from disclosure under the California Public Records Act, in that section, okay? Doesn't say anything about ownership or anything in there. And the prior reference to in paragraph 1 just says the state registrar shall arrange and permanently preserve the certificates in a systematic manner and shall prepare and maintain comprehensive and continuous indices of all certificates registered. So what I'm reading here is that local registrars and county recorders prepare and maintain records.
Again, from what I understand, we go in and we check boxes to say that everything is complete.
Okay, so you're saying that is the job of the Department of Public Health? Are you saying your job is not to prepare and maintain these records?
Correct.
Who is?
The state.
Locally, the local
So
record.
again, the coroner gives some portion of it, the
Okay.
physician gives some portion of it, the funeral director, they give some portion of it, and then together, that report is in the database. One of our clerks opens that database up, looks at the report, says everything is there, send it to the state.
Okay, so that in and of itself is a record.
Yes.
Okay. So are you able to provide how many of those records you have sent to the state?
No,
Why not?
because that is not a record, we don't have records of it that would entail going in and looking at each day and saying, how many records are there on this day 1, January 1, et cetera, through the entire year.
Does the state require an audit to reconcile how many they received and how many you have sent?
I don't know.
Because from what I'm hearing from Mr. Roddie, the one thing that I'm concerned about, beyond all the other information that he's asking for, is you're claiming there's a dearth of information, okay, or that there's no information.
I'm not allowed to give that information out. Can our clerks see it? Sure.
Who has the authority to give that information?
The state.
I'm-
And they give it out, they have an application for it, it says researchers apply right here.
Who's the gatekeeper in the Department of Public Health that would ultimately make that decision?
The California Department of Public Health,
No, the San Francisco Department of Public Health.
the gatekeeper would make the decision.
Yeah, the person that would say, no, I'm not, definitely not going to allow this information to be released.
Well, I can give you the name of the director of the department, but it was really the state ultimately that told me, because what happened when we first were here, the first 3 times, I was going back and forth with the clerk,
I see.
with the same argument you had.
Got it.
What if? How long would it take you to do this? Let's figure it out. Let's do a report together. I was really trying to get Mr. Roddie's information.
Mhm.
And then as I pushed on, and got a lot of, just sort of, no, we don't do that, no, we don't prepare that report, I finally got in touch with the California Department of Public Health, who said, you can't give that out.
Okay.
And that's what they, I think, meant to say, but they didn't know that was the case.
And was the citation in the public health and safety code, is that what they gave you?
Yes.
Okay. All right, thank you. Member Musk.
So I'm inclined to make a motion to continue here. The more I look at this document that I brought on my computer, and I don't want to introduce it into this hearing, but I think it merits adding it to the record and considering it next time. Because at the very least, I'm looking at this, and it at least covers a portion of the records that the complainant was seeking. So I am literally looking at the number of deaths for various causes and for various races for a period for all of 2013. And he had asked for specific months beyond it, but nevertheless, it feels like there may be worth the Department of Public Health going back and looking at what it's already released online and figuring out whether some of that record is responsive, whether some of the underlying records of that have already been cleared to be made public. Just because, again, I don't want to introduce this. I think that we can consider it the next time.
I would just note for the record, in this particular section of state code, it was amended in 2016.
It was amended.
It was amended in 2016. It was effective September 9th, 2016, so it was an immediate.
This was released in 2017, this document.
Oh, okay.
Yeah.
Okay, so I just wanted to say that, I don't know what was amended in here, so
Yeah.
that's all.
Can
Okay,
I respond to that?
sure.
So if an epidemiologist requests that data, yes, they can publish it, right? And that's where you go, is to the state, get your data, and you're allowed to publish it. It's just that you need to go through the proper channels.
Right, but if he had asked for the records, the data, that it already appears in a document that you've made public, then he should have been directed to this document. Or at least that, I don't want to get into us arguing that now because we don't have the document on the record, and so I would like to
All right,
enter
so,
the record.
okay, let's discuss that in a moment.
Okay.
I want to give everybody else an opportunity, then we can talk about procedure on what we want to go next. You suggested possibly continuing this. So we'll go from Member Nada and then Member Wolf.
I'm fine.
Okay, Member Wolf.
I like the idea of continuing this, but what I'm hearing is basically that gatekeeper preventing the employee of the city of San Francisco from giving that information is actually a state agency. And I don't know whether we can send a request for information to the state public health, but like I would like to understand better how this came to be, what the reason for this denial is. I realize it goes beyond the scope of our mandate as a Sunshine Task Force, but at the end of the day, there is this record that the only reason our local government doesn't keep their own accounting is because the state has built up its own network and then denied our city from giving access to that. So I think it's important to better understand that and potentially to recommend that this county maintain their own records. I mean, obviously they're probably not going to, but basically what's happened is that rather than maintaining local records, we've created a state record that then the state is controlling access to, and that is a little disconcerting to me.
Member Moss, can you state the reason for continuing?
I would like to continue this matter so that.
Should we go through rebuttals first?
No, I don't think we should go to
Okay.
rebuttals. I think we should say that and not waste people's time.
Okay.
So I would move to continue so that the San Francisco Community Health Assessment and the San Francisco Community Health Needs Assessment appendices can be added to the record and reviewed by both the complainant and the respondent to see whether there are responsible members around. Or so we discuss it.
Okay, is there a second?
I'll second that.
Moved by Member Moss, second by Member Wolf. Any discussion on the motion, members? Any public? Go ahead, Member Tesfaye.
I just think that, the parties should use this information that they've heard today to pursue this line of action, and I don't think it merits us continuing the item based on information that we are finding on our own off the cuff.
Are you seeking to make another motion?
No, I'm just going to say I'm going to vote against the motion.
Okay. Let's call for public comment. Any public comment?
I don't think we provided an opportunity for rebuttals.
Where Member Moss had suggested that it wouldn't be productive to do rebuttals until this information was seen. So that way, if there's some alternate adjustment to the case, that can be made, and then once that information now is being introduced by the task force to parties that will continue it and then continue where we are now is discussion, and then once we're finished with all of that, based upon responses from the parties, then we'll have rebuttals. Okay, public comment on. No, your party, sir.
Oh, sorry. I do have a comment I'd like to make, if that's possible.
Yeah, I'm sorry.
I do have a comment I'd like to make, if possible.
I'll
Clarificate.
take it here at this particular moment.
Okay.
But not as part of public comment. Your party, so you can. Well, I'm allowing you to speak.
So really, what I want is we haven't had even a legal opinion from the state whether the numbers of deaths were somehow exempt. They weren't asked that. This section was quoted for the second part, and that and I think the city attorney should check into this law.
I'm not following you.
My original complaint, the most important one, is how many people died.
Right.
The response from the state of California was responding to the second request when I asked for cause of death, age, gender, a significant records with, fields within the record. The original one was just how many records themselves, which is a separate thing, and we don't have a opinion either from the state or from the city attorney on that.
Right. So
That needs to be looked
I
at.
think, and the members can chime in, but I think I can speak for the members here.
Mhm.
The respondent claimed that it was they were unresponsive. There are no responsive records.
That was the response to the second request, not the first request.
How many deaths?
They wouldn't even say how many or if anyone died.
Unresponsive.
Unresponsive. They did not reply. That was the original complaint. When they said they were going to try and get it to me in 11 days, I dropped that first thing because I thought they were going to do it, and then they stonewalled me. And then they quote when I asked for the more detailed one. That's when they got the thing from the state.
And I
So it doesn't apply to the original
I
one.
completely understand your concern about that.
Right.
You know, first they say yes, and then they say no. You know, or we don't have it.
But the state hasn't even given an opinion on the original
I
complaint.
understand that,
So
but
that needs to be looked.
But we have no jurisdiction over what the state does or does not do.
Well, the city attorney should have some idea whether.
But that's not our jurisdiction. That's somebody else's jurisdiction.
Well,
Our jurisdiction is specifically the California Public Records Act, the Brown Act, and the local Sunshine Ordinance. That's it.
and they violated that because they didn't produce the numbers of deaths. And the only defense that they have, this quoting the comprehensive death records cannot be given, was only referring to my second request, which was more detailed. The original one, the numbers of death, has not been addressed.
But the numbers, the question is are there records? If the department, we can't determine whether there are records.
Well, there are records. This was testified at this hearing, where the clerks can look up records through the system, so they can tell. They can even like look at a date and say, oh, look, there's 4 deaths there, and like write it down on a piece of
I
paper.
don't know if that's the way that system works.
It's a database.
Some databases, there are a lot of databases that don't collect logs. You know, there's lots of stuff like that. If it's not described to us in any specific kind of way.
We were told.
I think, Mr. Roddie, in the interest of time, because we are going to continue, most likely will continue this item, is with the introduction of the information that Member Moss is now including in this record. You should review this. Ms. Acosta should review it. That has specific information. I think that's
Unfortunately, not by day. That's what I'm actually the core of my research is how many people die per day. Over a period won't help me. Unfortunately,
I understand that,
Yeah.
but you know, we can only do so much. We are not. We have very little authority to compel anything. Okay, if we find that a record exists, and we know, and there's evidence that it actually exists, and an agency or a department refuses to produce it, then we have authority to compel them to produce it, because if we find that it's a public record. And in fact, the city attorney's office has their own supervisor of records that does more or less the same job as what we do. Okay, and that's contained in the Sunshine Ordinance. Okay, that if they find that a record exists, and that is public, and the department or a custodian refuses to produce it, they themselves can report that person to the State Attorney General. Okay? We don't have that kind of authority, per se. We have authority to refer it, okay? But we don't have the same weight as the supervisor of records, who is the city attorney, to be able to do that. So, what we're doing, because you presented this to us in this venue, is with the extension of Member Moss introducing this new information, we're going to continue the case. Both you and the Department of Health can review it, see if it pertains to anything. Maybe it spreads some light on something, and that is information that's publicly available because it was produced in a different set of channels, kind of thing. But in the essence of time, we feel that we would spend an enormous amount of time continuing to go through down a rabbit hole.
I'd like to sum up one thing. Someone should ask the California Department of Public Health if the numbers of deaths per day are exempt. That has not been asked.
I understand that.
That's all.
Again, it's not our jurisdiction. It's- We are procedural.
I know.
Okay, so when it comes to the content of those things, it's one thing. If it's with some specific procedure, like the state is supposed to deliver this information to the local agency to preserve for local consumption, that's one thing. But we have not heard that.
Yeah.
Well, I think what Member Moss is introducing is that there's some evidence that exists out there that is kind of counter to what's been presented here today. And that you folks should look at that. And then we'll come back sometime in the near future and we'll review this again with that new evidence. Okay?
Good.
Great, thank you.
Okay.
Okay, so we've reached the point to now where we have a motion on the floor?
Yes, there's a motion to continue.
Yeah, okay, now okay. Any public comment on the motion? Seeing no public comment, please call roll.
On the motion to continue the matter to the call of the chair, Member Moss.
Aye.
Moss, aye. Member Josh Wolf.
Aye.
Wolf, aye. Member Fisher.
Aye.
Fisher, aye. Member Hinty. Highland absent. Member Eldon. Eldon excused. Copra absent. Member Tesfa.
No.
Tesfa, no. Member Kanata.
Aye.
Kanata, aye. Member Hinty.
Aye.
Hinty, aye. Chair Wolf.
Aye.
Wolf, aye. The matter is continued to the call of the chair. I would like to request if Member Moss can send me that link so that it can be included when we do reschedule. And I do encourage the parties to, I will send a copy of that link to the two parties when I do receive it. Next on the agenda, item